from different states told us this morning that they were really caught off guard by this announcement. They were ready to put shots into people's arms and had to scramble. Can you explain that chain of communication? When and how did you notify states that they might have to pause?
Right. Well, as I said, we didn't know about anything in terms of the announcement until last night. We didn't even know the content of the announcement until this morning when everyone else read it. As soon as we got that, our team farmed out and started contacting folks to make sure that everyone knew that that was now announced by the FDA and CDC. Tuesday is the day that I have my regular governor's call. So that was fortunate that that was at 11 a.m. So we had all the governors already lined up with their teams, and we had Drs. Fauci and Drs. Walensky join that call, and the teams will continue to support the statewide efforts, the federal channels, the community health centers to make the adjustments. So I think the message got out very clearly and quickly. There was no heads up here. The announcement was made this morning.
Thank you.
Thanks, guys. Just two quick ones. The first one, and you might not have the answer to this, do we have a timeline in terms of how long this is going to, are we talking days before it might get flipped back on, or a week? And then second one for Jeff, if you don't mind, I understand what you're saying on the macro level related to supply, but when you talk to local officials, the J&J shot, because of storage, because it was one shot, was considered a crucial component in rural areas and kind of underserved communities. How does that not affect the timeline that you guys are on in terms of actually getting shots in arms?
During one of the questions which was asked, I believe, of the CDC, the question was just yours, and I don't know what they're going to be doing. What I heard from the previous press discussion was it's going to be more like days to weeks rather than weeks to months.
We have plenty of supply, and we have plenty of vehicles for delivering that supply, whether it's through the federal pharmacy channel, whether it's mobile units, community health centers, and all of those are equipped to deliver the Moderna and Pfizer vaccines. So we'll make sure that those units continue to grow in number, because you're right, we need to reach people where they are, and the mobile units and the community health centers are particularly essential for those. And they have been receiving Moderna and Pfizer doses since we began both those programs.
So it's no different. You just swap out the vaccine if it was a mass vaccination center or if it was a mobile unit going to a rural area.
Now, the Moderna and Pfizer vaccines, as you know, are 2-dose vaccines. Right. So it's important that people come back for their second dose, 3 weeks post their first dose of Pfizer and 4 weeks post their first dose of Moderna. But all of our units, all of our delivery channels are equipped to deliver both Pfizer and Moderna.
Just real quick, how does this not contribute to, those are the very areas where hesitancy, I think, is most predominant at this point in time, based on what you guys have seen? Do you have to change your message? Do you have to do something different to address hesitancy in the wake of something like this?
No, I think we need to continue to be transparent about what the science is telling us. That's what brings us here today. There's, as Dr. Fauci said, there's been tens of millions of doses of Pfizer and Moderna administered over the last several months, and millions of people, both in the U.S. and around the world, have been safely vaccinated. I think it's important that we have here the FDA, and the FDA is the gold standard for ensuring the safety and the effectiveness of the vaccines. And today's action, I think, is clear evidence that they're taking every step necessary to ensure the American people have clear and transparent information about the safety and effectiveness of these vaccines. So the bottom line is the vaccines, Moderna and Pfizer, that are now being administered are clearly safe and are saving lives, and every American should get vaccinated when it's their turn.
Shepard Smith here. Thanks for watching CNBC on YouTube.